Let's settle down. So briefly, we want to move to the needs of Nigerian nurses. What do we really need? Number one on my list, improved working conditions. Improve working condition. Improve working conditions. Number two here, better salaries and incentives. When you talk about incentives, it does not mean we are not talking about salary here. Awards, letter of motivation, letter of encouragement. Nurses should be encouraged. Then career development and training. At times after your BNSC, you go for your master's, and after presenting the certificates, the government should try as possible to advance you to the next level. Those are the needs of the nurses. Then mental health and wellness support. We need counseling services. Counseling services, stress management program, and peer support networks. Then government policy reform. We also need stronger healthcare policies to support nurses and to improve them and to improve retention. How can we improve retention? How can we help nurses not to move outside the country? If all the following can be done, then there will be nurses retention in the state. Then public awareness and respect. People don't longer respect nurses. They don't respect us anymore. I think Monday stroke and Tuesday, some hoodlums visited the Okitipupa General Hospital and some nurses were beaten. Yes, they were beaten. Same thing happened in Okiaro Mother and Child Hospital on Monday. The patients are hungry, the nurses are also hungry. You know, there are a lot of things going on in the country. So we need job stability, safe and a friendly work environment. That nurse is on admission now in Okitipupa. So you can imagine a patient just walking to the hospital, then flogging, beating people that are taking care of you. Imagine. So we need a safe and a friendly work space, work environment, where we can actually work and be relaxed. So what are the core challenges faced by nurses in Nigeria? Number one, poor working conditions, low remuneration, limited career growth opportunities, poor training opportunities. Gone are the days when we were in our comfort zones, School of Nursing. Anytime there is workshop, government will normally sponsor all of us. But here, I'm sorry to say, you have to sponsor yourself. You just have to sponsor yourself. If you must grow, you must dip your hands into your pocket and sponsor yourself. And that is what we have been doing. Then lack of government support, inadequate staffing. From the days of School of Nursing, we were told the WHO standard is a nurse to 4 patients. I've never seen that up till this moment. Is it that a nurse to 20 patients, a nurse to 15 patients, a nurse to 18 patients? And we have been coping. And nurses are moving out of the country. Poor hospital infrastructure and unsafe work environment. Lack of free medical support. Lack of free medical support. No free medical support for nurses. If you are sick, you will have to put your hands in your pocket and take care of yourself. You will have to care for yourself. No free lunch anywhere. High patient to nurse ratio, stress and compassion fatigue, then violence at workplace. And the last one on this point that I also want us to discuss is burnout. Looking at all this EU, then we need to address burnout. If we must nurse the nurse, then we need to address the issue of burnout. And I'm going to be explaining this using the 3-tier model of nurse burnout. At the base, we have persona. That persona is talking about an individual, talking about the nurse. What are the things that can affect? What are the things that can motivate you? What are the things can prevent or influence you in performing your duty? And at the second level, that is the institution, that is the organization level. That is the hospital. And the third one there is the system, that is the patient or the community that you are caring for. Let's take this one after the other. Looking at persona. When there is exhaustion, either emotionally, psychologically, and the rest, when you are feeling drained, overwhelmed, unable to cope, and when there is also reduced job satisfaction, you are just going to the working place. You are no longer satisfied. You are not happy doing the work. So then you know at that level that burnout is already setting in. Then developing detachment from patient. You are at your place of work, but you are not ready to even touch your patients. You don't want to touch them. You are even tired on arrival. You don't want to do anything. Burnout is already setting in. Then physical symptoms like headache in the morning, afternoon, noon, insomnia, fatigue, and the rest. Then increased calling sick. You're always sending messages to your manager. Please, I won't be able to come today. Oh, I'm having this, I'm having that. Fatigue, burnout is already setting in. Then mental health issues. We have a lot of nurses in the setting now that having one mental issue or the other. Some are depressed, some are nursing one condition, one ailment or the other. This is at the personal or individual level. And when you look at all this, if nothing is done about this, it will affect the organization. Do you agree with that? So at the level of organization, there will be higher absenteeism. People are just calling in sick. And in view of this, when you look at the statistics of the nurses and the patient, then there will be need for the organization to employ more staff. And when you are employing, you are spending more money because you are still need to train them after the employment. Then overburden of the remaining staff. At times, you place your advert for people to come and join the system, and they are not showing up. It has happened in this state over and over and over. Even without interview, people, okay, please just come. Come and take your employment letter, and they will not come in this state. And that is the situation that we have found ourselves. Then decrease morale across the team. Then at the patient level, this will also affect the patient level, that is the patient outcome. It is going to cause longer waiting times. Assuming you are the only nurse on duty and you need to attend to about 10, 20 patients during antenatal, you need to palpate like 20, 40 patients. And you will need to take it bit by bit, one by one. Then looking at this, spending 8 hours, 4 hours on a particular session, then this is taxing, this is draining, and it's demanding. So there will be longer waiting hours for the patient, then there will be reduced patient-nurse interaction. We have said a lot about interaction, that nurses should interact with their patient. But when you don't have the time, how are you going to interact? You have a lot of patients lined up for you, and you are still discussing, then you move. You don't have the time. Then higher risk of error. You tend to make mistakes. When you have a lot on your bowl, you're trying to make mistake. And there will be also what? Lower patient satisfaction. Patients are just coming, they are not satisfied. They are not satisfied with the hospital services, and they are paying. And I want us to know that there is a relationship between these three tiers of burnout. So there is interconnectedness of each level. The personal, that is the individual, we affect the organization in turn, we also affect patient outcome. So what is the way out? And that is why we are here this morning. What is the way out? And nursing the nurse in Nigerian context require some diverse measures. You cannot do it alone as an individual. So you need to address burnout, you need to address stress, and the well-being of the nurse. So, like I said, it's multifaceted in approach, and all these factors that I've listed, they have one role or the other to play or to carry out in nursing the nurse. Number one on my list is government and policy makers. So we are going to be addressing each of these factors. Under government and policy makers, the government must develop national policies that will support the well-being of nurses. One thing is to develop, one thing is to have a policy, another is implementation. In Nigeria, we have a lot of policies, but what comes to implementation? So governments must be ready to develop and to ensure implementation of policies that will favor nurses. Then they must also ensure staffing ratio. We talk about short staff here and there. Government has the ability and the power to employ. Organization cannot employ. Government needs to have all this and to put them in place. Then government must also approve and allocate funding for nursing education. This is very, very important. You cannot rely on your knowledge, the knowledge you acquire in school of nursing or in your first degree. You must move further. Take your master's, go for your master's, and you also go for your PhD if time permits and if you are willing. That is the good thing to do. Then providing funding. At times there are some certain amounts that are supposed to be rendered or given to the hospitals or to the institutions by the government. At times, government may not drop this money. They may not give to them as at when due. So government should release fundings, subvention, and resources to the healthcare facilities. Then they must also develop policy, implement, and advocate for better wages. In the last 2 months, the salaries of health workers were increased. But when you get to the market now, it's like you are still collecting your old wage. Everything has, gone up. Still on government and policy, promoting fair remuneration. You don't need your employers to go on strike before you sit down and improve their wages. Government has a lot of role to do. They need to look inwards and make their people happy. Traveling expense and allowances, health insurance, car loan, uniform allowances, housing allowances, all these should be prepared and made accessible to nurses. Then there should be prompt approval for education and training opportunities. Then there must be improved power supply. Since yesterday, we've been having lectures on AI, do this, robotic, monitor. If you don't have appropriate power supply, you don't have power supply, then how do you expect all this to function? You have a robot. Robot cannot work on its own. There must be a steady power supply. Most of our hospitals depend solely on solar. They depend on solar. So there must be adequate power supply in our hospitals. Then when there is power, I think about 70 or 50% of the problem is solved. Then there must also be adequate water supply. Government must ensure that our taps are running in the hospital. We are expected as nurses to wash. You are to wash at the end of each procedures. But when there is no water, at times you don't want to touch your patient, most especially patients in isolation units. So there must be adequate water supply, improved water and power supply. Then there must be security of lives and properties. There must be security of lives and properties. Nowadays, we have policemen in the hospital. We have security people in the hospital. So we move to the next one, which is the health organization. There must be leadership sensitivity training. At times, the problem of organization are the leaders. So the leaders must be sensitive to the need of the people under them. They are subordinates. They must try as much as possible to go for training so that they will be able to mentor those people under them. They also should be able to give incentives, reward, and they must also ensure career opportunities. If there are workshops for people to be trained, leaders should encourage people to go. They should sponsor, they should allow them to go. Then there is also need for data-driven nursing reform. There must be high-tech, high-quality data collection. We must know at a particular point in time, how many nurses do we have in the hospital? What about the ratio of the patients? All this information we have to plan and to make appropriate budgets. Then we must ensure reasonable nurse-to-patient ratio, then offering mental health support and counseling services. And the last one here, promoting work-life balance and self-care. Still on the health organization, the organization that is our health institution must encourage professional development and continuing education. We must have this department in all facilities. So there must be regular training and retraining of our health workers. Then implementation of policy. Like the government will formulate policy, then at the level of organization, it should be implemented. Then the leaders, the organization must also encourage open communication and feedback. They must be ready to assess feedback from the workers. Then they must ensure regular promotion exercises and foster respectful workplace, and there must be recognition and career. Then moving to nurses, nursing leaders and managers. Leaders must lead by example. You cannot give whatever you don't have. Leaders must be ready to mentor. Leaders must know the problem of the people under them. So this is so important. They must listen to feedback, and they must also offer mentorship programs. They must know much more than their followers. They must get trained. They must go for conferences and workshops so that they can manage the people under them. Then coming now to educational institution, what are we to do to nurse the nurse? In educational institution, there is need to integrate self-care and resilience training into nursing curricula. Sometimes ago, I think about 2 months ago, Nursing and Midwifery Council of Nigeria added some courses to the curriculum. And now we have started to train our students on these new courses. Then as an institution, we must also be able to provide mentorship program to support new nurses that are coming in. That is our student. Then somebody made mention of this yesterday, that anyone can fall sick at any time. Anybody can fall sick at any time. We should train our students to the extent that whenever we are sick or we are under their care in the hospital, we'll be able to sleep with our 2 eyes closed. No, we must train our students to that level. We must be relaxed under their care. And that is what about educational institution. Then we must also provide and encourage continuous new education. And that is why we are here today. Then professional organizations also have a role to play in nursing the nurse. That is to advocate for better working condition and policy reform, and to offer peer support network and wellness, and to also provide legal and financial assistance to nurses facing workplace challenges. And the last one here is the patient, second to the last, and communities. The patient also, they have a role to play. Respect begets respect. We are also expecting our patient to respect us. We want our patient to appreciate us. It's not about giving money, but we also expect some level of decorum. We expect some level of respect from our patients and the communities. And the last one here, which is the most important, is the icing on the cake of this lecture, of this presentation. Number one here is the science of self-care. We must understand our body. The most important thing here, we have talked about the roles of the government, the policymakers, the leadership, and the rest, the association. But the last one here is the science of self-care. We must rest. As nurses, we must learn to rest. If you don't choose a day to rest, I think somebody posted that on our platform too. Your body, your system will shut down and get you a day for you to rest. And that day, you may not like it. You may not like that day. So we must try as much as possible to pick a day to rest, so that the system of the body will not pick it for you. Then you prioritize adequate sleep. There is a difference between sleep and rest. When you are sleeping, you are sleeping. But when you are resting, at times, when you are resting, you are not sleeping. You can be resting with your 2 eyes open. But at times, what do you do these days? When you are resting, you are with your phone. You are pressing. You are not resting, no. Anytime you are resting and you are with your phone, you are not resting, because all your senses are working. So when you want to rest, drop your phone somewhere, shut it down, or you put it in silence. Number 3, manage stress. I think Prof mentioned this during our presentation. Learn to do breathing in and breathing out exercise. Take a deep breath anytime you are stressed. Either at work, maybe you are lecturing the student. Take a deep breath, breathe in and out to ease stress. Then the next one I have here is speak out. At times, we bottle a lot of things as nurses. You don't want people to know. You don't want people to know. You don't want people to know what you are passing through. I pray it will not be too late. So we must open up and speak out. If you are passing through anything, you must have somebody, a confidant that you can actually speak to. Then enjoy your off-duty or leave. When you are on leave, enjoy it. During your off-duty, enjoy it. Students, during your weekends, enjoy it. One house, listen to your system. At times you are feeling drained, you are feeling exhausted, you are feeling empty. I don't know, hello? I don't know whether it has happened to you before. You are just feeling drained, as if there is no strength in you. Your body is telling you something. Go and rest. Go and rest. Then when you need to get vaccine, please get vaccinated. Then you must embrace healthy lifestyle. As nurses, we preach to people. One house, please. We preach to people that we must maintain healthy lifestyle. So it's not out of place for us also not to be involved in drinking alcohol and not to do what? Smoking. It's not do as I say. It's not do as I say. Please, let us look into that. Then you must also do regular checkup. Once or twice in a year. But on a monthly basis, check your vitals. As a student, as staff, check your vitals on a monthly basis. Then still on science of self-care, continuous learning. The day you stop learning, that day you are gone. So continuous learning. Continuous learning. Attend workshops. Attend seminars. Either you have heard about it before. I want to believe that you will still gain one more thing. I've been learning since yesterday. New things. So I want to encourage us that we must continue to learn. God will provide money for us in Jesus' name. So you engage in activities outside the work to decompress your stress. Art work. If you can paint, if you enjoy painting, you go. If you enjoy going into gallery, go there, enjoy yourself, ease yourself of stress. Music. If you love to listen to music, you can rest by listening to music. You can watch movies. As lecturers, because we are always writing. We are always busy. I have 7 master students. I have 2 PhD students. I have 10 undergraduates. When are you going to rest? When exactly are you going to rest? So we must also do all this. Watching movies. Dancing. I want to say something about this. When I was in the hospital, there was this one house. There was this matron. Sorry to say something about Deeper Life. You know, Deeper Life, they don't dance. Abi? Is it that they don't dance in the church? I don't know. So this matron loves to dance. She loves to dance. And she will always be getting Tope Alabi album, all this. I say, madam, when are you listening to all this? You don't dance? Then they don't have television or radio in their homes. And she said, Iwala, do you know what I normally do? When I want to rest, I will lock myself inside my room, increase the volume, and I will dance. 1 hour, 1.5 hours, still dancing. You know, it helps. You must discover yourself. What is that thing that is working for you? Discover yourself. Enjoy your life. Then the next one here, one house, seek mental health support and therapy. When you are depressed, your system will tell you, seek help. See a therapist. Then practice good general health habits like regular exercises and so on. Then eat balanced nutrition. Eat balanced diet. Then the last one that I have here looks so funny, but try as much as possible to chill with friends and colleagues. Attend functions. Attend family functions. Attend family function, chill with friends, and they be happy. Then the next one, second to the last, go on vacation. Go on vacation. Prof was saying something the other time. She said maybe she used $7,000. Prof ma, I think you were saying something the other time that you used $7,000 maybe dollars, $700 for a workshop, to travel for a workshop. For a workshop, yes. Outside Nigeria. Go on vacation. Hello. Go on vacation. It will not kill us. One house. Go on vacation. Pack your suitcase. Travel. That contribution. That's your job. That's your contribution. You will collect. You have been contributing for over 2 years. When you get it, go shopping. Take care of yourself. Enjoy yourself. Set some up. And the last one that I have here, be happy. Be happy. Why am I saying all this? Next of kin are not nice, oh. Next of kin are not nice, oh. So the last one here, be happy. And I want to conclude by saying, nursing the nurse requires a multifaceted approach where healthcare organizations, nursing leadership, and government should create a supportive environment that promotes the health and resilience of nursing professionals. And more importantly, engage the science of self-care, as caring for others begins with caring for ourselves. Every healthy system begins with a healthy nurse. Let's prioritize the well-being of our nurses and create a healthier, more resilient workplace. Together, we can make a difference. Thank you for listening. These are my references.
one, please. Face your people now. Thank you, thank you, thank you. You can see we are nursing the nurse. So let's nurse the nurse so that the nurse can nurse other people. Thank you very much for your presentation, ma. Do we have questions? Nursing the nurse. Any question for Dr. Iwaola? Okay, you shall see us behind the scene, Abby. Okay, thank you very much for your presentation, ma. So, okay, we are moving to the next section. We are moving to the abstract section. And then the first presenter for this afternoon will be in person of Dr. Bolarinwa Oluwaseun.
Thank you very much. Thank you very much. Let me start on the existing protocol already established. I have a limited time to spend here, and I want to present an abstract, which is an extract from a thesis. It's an extract from a thesis submitted in partial fulfillment of my PhD thesis. And the title of the abstract is Psychological Experiences of Relatives Caring for Clients with Substance Use Disorders in Selected Neuropsychiatric Hospitals in Southwest Nigeria. The substance use disorder is a public health concern and a major social phenomenon leading to different problems, issues in our society today, affecting individuals that are using the substances, affecting their families, and also the society. And substance use disorders has become a key drivers of mortalities and disabilities among the general population. WHO established the fact that 1 in 8 people is now living with mental challenge, and among these is substance use, which is one of the chronic health conditions that is also bedeviling the sub-Saharan Africa, leading to reduced quality of life, both of the user themselves as well as the family members who are providing care for them. Sorry, IT is not on my screen again. It's not moving. Has it moved? Okay, all right. The statement of the problem. The effective care and management of individuals living with substance use disorders require that the family members caring for them be involved, because when they feel loved and the family members show that they care for them, it actually improves their ability to recover even when they are on admission. But then in Nigeria, statistics have shown that more than 60% of admission in our very few psychiatric facilities, we have about 60% of patients now be admitted related to substance use disorder or multiple substance use disorder. And this huge, the huge burden of caring for this patient is not only on the nurses or the health team, the mental health team that are providing care for them, but also the family members who care for them are negatively impacted. And psychological problems such as depression, anxiety disorders, emotional problem has also been documented among these relatives. All right. The objective of the study. The objective of this study is to explore the psychological experiences of relatives caring for clients living with substance disorders in selected neuropsychiatric hospitals in Nigeria. And the study focused on relatives of clients living with substance use at federal neuropsychiatric hospitals, Yaba and Haru. You know, these two hospitals, they are WHO recognized centers for rehabilitation of the of substance abusers. And it is believed that family members who have cared for patients for at least 6 weeks will be able to share experiences, you know, based on what they have had with their relatives. Because there are those who are newly admitted, those who have just been diagnosed with substance use disorder, and the relatives have not had any experience related with them, may not be able to know or share much experiences. They may not have much experiences to share, but those who have spent at least 6 weeks with them, caring for them, they have a volume of experiences that they were able to share on the feed. This is hanging. Don't know. Next one. Is it controlled inside or air? Because it's not even showing on my screen at all here. Please, IT. Please, can I use my own laptop? Thank you. All right, thank you very much, IT. So sometimes we're operationally defined as shown, and this is the conceptual framework for this study using the Bowen's family system theory. As I said the other time, this is an extract from a thesis. This focuses on different outcome variables like psychological experience, their economical experience, the problem they encounter, even why they are relating with the healthcare workers, because family also have issues when they relate. Some they are not giving them the necessary attention. So these are the things that these studies also looked at. So methodology, the design used in this study is the hermeneutic phenomenological design, which is a qualitative design. Then the study centers are neuropsychiatric hospitals, Aru, Abeokuta, and Yaba. The population is the relatives of clients that are living with substance use disorders in those facilities. Then the sample size, guided by data saturation, 18 relatives were sampled in these studies. And then because of the peculiarity of the case that you are dealing with, substance use disorder, convenient sampling was used because not every relative will be ready to share their experience. These are personal things, but there are some that are ready to share the experience. These are the ones that were sampled in these studies. Then an interview guide was used to conduct an in-depth interview among this population. And the rigor of the study include credibility, dependability, confirmability, and transferability. All these were put into consideration to ensure the rigor of this study. Then data were collected, having obtained informed consent from the patients, and the purpose of the study discussed with them. Privacy was provided, and being a qualitative study that requires them to share their narratives, the data were tape recorded, and feed notes were also taken. Analysis was done using thematic analysis, and ethical approvals was obtained from 3 different institutions, Babcock University, and each of the federal universities also. This is showing the socio-demographic characteristics of the participants in this study. As you can see, the mean age of the participants was 44.72 plus and minus 15.65 years. And in this study, we found out that we have more of male relatives who were ready to share their experiences. It's not to show that it's only the males are the major caregivers. But this time around, what I felt was that males were ready to share experiences with the researchers. I met a couple of women, mothers of relatives who were not ready. They were not even emotionally stable. That at the time that we started talking, they were shedding tears. You know, such people, you cannot continue collecting data from them. And some of them, we see contact today, asking about the welfare of their ward in the psychiatric hospital. So these are other results. Now, about 7 teams were generated for this aspect of the study. And team 1, we found out that some patients had positive emotion associated with caring, despite the fact that this is something that could be painful, something that can be touching, and one can be emotional. Some relatives have a kind of positive emotion towards caring for their patients. As it is reported by one of the relatives at Aru, Abeokuta, said, I feel good caring for him. It does not disturb us. He's really doing good at home. He's always playing, sitting inside, and minding his own business. He is not violent. So, I feel good caring for him. Now, another theme is psychological reorientation. I will not be able to put all the discussion because these are discussions now. It will take more of our time. So, team 2 look at psychological reorientation, in which some of the relatives had a kind of reorientation about what people have been saying about substance use disorder in the public. Somebody reported that it is more of an enlightenment for me because I noticed that my sister started substance at a very young age. What I saw here makes me know that there are more people like this in the world than just her. So it's just more enlightening to me as I'm seeing most of the people here are young. So I made up my mind never to engage in such a habit in the name of enjoyment or allowing anyone to lure me into it. That is interesting. Team 3, depression. We have patients who had symptoms of depression and who reported that they were almost depressed when they felt that when they knew that their relatives were into substance use disorder. One relative reported that whenever my mind goes there, I feel depressed. Another one said, psychologically, I am depressed because this is not what I imagined myself doing at the age of 23. So it's actually really bad. It is really, really bad. All right. Now, emotional trauma is another theme that we generated from the psychological experiences of relatives. One patient relatives reported that I was down psychologically. I had emotional disturbance and a lot of anxiety as a result of his condition. I lost my ability to have sound sleep because I was always thinking about him. I don't have rest of mind. You see that somebody saying this, it's traumatizing. And this is not the patient, but the patient's relatives. For you to know that so many things are going on in the mind of relatives that are caring, that are caring for their patients in our hospitals. Anxiety problem is another theme generated from the study. One of the relatives reported that I had emotional disturbance and a lot of anxiety. As a result of his condition, I lost my ability to have sound sleep because I was always thinking about him. I don't have rest of mind. That's a form of anxiety too. Then another one reported that, man has to think. I am anxious about the whole situation. When this will be over and the like. Does not know when it's going to stop coming to the hospital. Because there are some of these patients, they are becoming over and over again. 10 years, they have been in and out of the psychiatric hospital as a result of substance use problem. Lack of motivation and anger was also another theme that was found out in this study. The motivation is not even there. Who are we going to tell that will not mock us and our family? We are really disappointed. I am not even proud of coming to this place every time. We are hungry because we are not happy with him. Some of them are showing some level of anger towards their what? Towards their relatives because of the situation they find themselves, because of the environment they find the patients now. The last theme is mental stress. A patient reported that he has mental stress coming to care for his relatives in that hospital. Sorry, a relative reported that he has mental stress coming to care for his patient in that hospital. He said, yes, it is actually mentally draining. And it is just too much to handle at times. One will be confused and not be able to think straight. These are the reports, verbatim, from relatives who are caring for their patient with substance use disorder. Now, discussion of findings. The mean age of the participants was as shown, and that finding was related to the findings of Minor et al. 2021, who also reported that the mean age of their relatives of their participants were 45.83 plus or minus 13.3. Then, positive emotion was one of the psychological experiences of the participants in this study. This was also reported by Aylo et al. And Mooney et al. 2024. Depression was a predominant negative psychological experiences among the participants, and this corresponds to the study by Swanepoel et al. 2022. Emotional trauma was also another theme that was generated, and this finding was also consistent with that of Halayo et al. 2019. Anxiety disorder or anxiety problem being reported among some of the participants was also consistent with the findings of Akio et al. 2023 and Mukilich et al. 2023. Findings also reveal that participants had mental stress related to caregiving, and this corroborates the reports of Stanley et al. 2022. The conclusion and recommendation. The study concluded that many of the participants caring for relatives or patients with substance use disorder have unpleasant psychological experiences. And if you are not close to them, you will not know what they are actually passing through. And oftentimes, nurses will just call relatives of so person. You have not procured this drug. You have not done this. You have not done that. Whereas these ones are also going through a lot of psychological problem that oftentimes they even forget what you have asked them to do. If you are not closer to them, you will not be able to know some of these things that they go through. It is therefore recommended that government, non-governmental, and professional organizations should formulate policies that will promote relatives' well-being as they come to our hospitals to care for their patients. There should be policy that will also help them in the process of caregiving so that they themselves will also live a holistic well-being. Now, healthcare professionals, nurses, and other healthcare team should also incorporate services such as counseling, psychotherapy that will improve the psychological experiences of relatives caring for clients with substance use disorders across Nigeria. These are my references. Thank you for listening.
Thank you very much, Dr. Bolarinwa. We are very, very grateful. So, we have listened to Okay, that's the presentation from Dr. Bolarinwa. Another round of applause, please. Any question? Any question? A qualitative study on the mental state of relatives of patients that have substance use disorder. Any question? You can see a research from here. Me, I'm seeing a research that patients who are suffering from substance use, we need to assess the mental state of those caring for them. True or false? Because they are caring for these people, and the stress now is beginning to drive them psychologically not balanced. So before we know it, so that they too will not come down with mental illness. It might not be a serious one, but anxiety is mental illness. It was discovered here. Emotional disturbance is mental illness. It was discovered there. So maybe who will do that? Year 5. Assessment of mental states of patients or relative of patients with substance use disorder. I hope somebody is taking note of that. Okay, that's on a lighter note. Thank you very much, doctor. So the next person on a we are moving. Oh, there's a question. Oh yeah. Be fast. Be fast about it while our chairman is the next speaker.
Good afternoon, everyone. Good afternoon, sir. So I wanted to ask, children that are given birth to by mothers that engaged in substance abuse, are they treated as psychiatric patients or they are just treated as normal babies? Like, is there a provision for them in the psychiatric ward in Nigeria?
Thank you. That question is children given birth to by parents who abuse psychoactive substances, are they regarded as patients? If they are not into psychoactive substance, they are not patient. Hello? If they are not involved in psychoactive substance use, is that your question? Yes, they give back to the parents are into psychoactive substance use, but if the baby does not have any symptoms of mental disabilities or mental disorders. The baby cannot be regarded as having any mental disorder, let alone talking about the fact that, okay, mentally having substance use disorders. Although you may have some baby who maybe when their mother is carrying them in utero, the mother use psychoactive substance, maybe like alcohol or other thing. You may have baby that are born with alcohol baby syndrome. All right? That is a peculiar case. You have to treat that patient. But any other child given birth to by a parent who abuse psychoactive substance, if they are not into psychoactive use, you cannot say they are patient for that same category. All right? Except for those who may have the symptoms already in them, and you have to attend to them. I think I've answered your question. Did I? Did I?
Thank you very much. So the next presenter, in person of Dr. Adigun.
By the power bestowed on me as the LOC chairman, I can spend 2 hours now waiting. But I will make it very snappy. Good afternoon, my dean, our prof, PG students, undergraduate, faculty of nursing staff, and everybody. I want to thank our dean for making this possible. We are enjoying the conference. And those that paid 5,000, God knows shame also. So we thank God for the success. So I'll be presenting this, evaluating the outcome of a nurse-led intervention on health promotive lifestyle for cervical cancer prevention among market women in Ondo State. All right, these are my outline, and we know cervical cancer is the tumor of the cervix, and presently we have 80% of deaths from cervical cancer, and health promotive lifestyle like vaccination, good lifestyle, can really prevent this. It is curable if it is early diagnosed. And appropriate health education for women will really help us to reduce this menace. And the statement of problem, it is a leading cause of gynecological system, accounting for 65.7%, which means 22 women die every day from cervical cancer, and at least a woman is passing on for cervical cancer in Nigeria every day. And this morbidity and mortality rate has been reduced in advanced country because they have the knowledge. And this is the gap that I want to fill. And this study was conducted, we have focus group discussion, the study of the objective, I conducted focus group discussion among market women, a pre and post intervention to see their CAP, knowledge, attitude, and practice of health promotive lifestyle. I determined the uptake and acceptability of cervical screening among these market women by conducting a free cervical screening in the market to see if they are going to accept this, and a guideline was developed. These are my hypotheses and the theory that was used and it was applied, and the methodology. It was a quality with 2 experimental group and 2 control group. And the market that was used was Agagu and Adedeji in Akure, and Oshele and Garage market in Akoko. And this has the population and the sample size. And for the qualitative participants, for the in-depth interview, we have 10. For FGD, we have 6 group of 6 women, which make 36. And the total participants for the qualitative, 46. All right, the sampling technique was a multi-stage. Purposively, the experimental, the 2 senatorial districts were selected, and the 3rd senatorial district was used for my pre-tests. And a random sampling through a ballot box was used to select 2 major markets in these capitals. And purposively, the experimental group was selected because we need to carry out some experiments there. And systemic random sampling was used to select participants. For the quantitative, it was purposive and convenient till data saturation. And I have a test paper and interview guide that was used. And the work was in phases. The phase 1 was a preliminary review, where we have the scoping, then familiarization, visit to the market, and a pretest was done. And we have phase 2, which is community engagement, the interview, FGD, and the activities were done. Phase 3, intervention, assessment, and post-tests. And the last phase, implementation and guideline development. And this was the weeks that this team spanned through before we arrived at the results. Validity was done and the reliability was done. And I said the third senatorial district was used for the pretests. All right, for the qualitative data analysis, method of data collection, through interview, like I said, and for the purpose of development of guideline, NGT was used. This is nominal group technique, where you bring in those that are involved in this place to decide. Then this guideline was done, and the researcher was the moderator. This was the for the results. This was the data for the biodata. That was it. And sorry. Okay, thank you. For the qualitative analysis, for the knowledge, some of these were said, none of my family has suffered from it. And I don't know anyone that have experienced it. But we have heard on it on radio. Where the wife of the governor was talking about it. This was said by Iyapate. And that means she doesn't have any knowledge about it. Somebody said, I've seen it with my eyes, but I thought it was an arrow. But at the end of the day, it was this thing that you were talking about. So they assumed that it was an arrow that was fired. Yes. And some said, we don't know about cervical prevention. They said, I don't know anything. We don't know anything about it. We have never seen something like this. And some said, since I have never heard of this disease, I don't know that they do cervical screening to test it. I am just hearing it for the first time. Some people said, we have not heard that there is a vaccine for prevention. It is only COVID-19 vaccine that we are aware of, which means for the prevention, they were not even aware. For the team on misconception, you can see it. They said it is caused by irregular sex. That's when you are not having sex regularly, you can have cervical cancer. It's a spiritual attack. Giving birth to many children cannot cause it. Poor hygiene cannot cause it. Early motherhood cannot cause it. So there are some misconceptions. For the quantitative analysis, on the awareness, on the knowledge of the health promotive, at baseline data for the experimental group, it was 53, but at 12th week, it has moved to 107. We can see a spike in that. On the control group, it was 30, and it was 69 at the end of the 12th week. And this is a tabular representation for the knowledge. You can see it's growing for the experimental group. For the control group, you can see that the growth was not so, except for some little changes. That's for the knowledge. For the attitude, this is also a tabular representation of my results. At baseline, we have 23.1. And at 12 week, the positive attitude has risen to 84.6. And for the practice, when we look at the practice for the experimental group, because I really wanted to see if this is going to work, we have 12 at baseline, and we have 42 at 12th week. And we can see the increments. For the practice of health promotive lifestyle, good practice, 83.7 at the 12th week. And for the poor practices, for the good practices for the control group, you can just see a small ladder height. All right, and for the uptake, because after teaching them, I have to do a cervical screening right there in the market and see those that will come out. And this made me to see if they are really accepting this prevention. Looking at it, you can see that from the experimental group, just 2.2%. And for the experimental, 36.4%. And for the control, just 2.2%. And discussion. This study is in contrast with Olubodun et al., who deduced that most of the women had never heard about cervical cancer. Some have heard about it. Also, this finding is in concordance with Oyeyemi et al. That reported that cervical cancer screening was stigmatized. I really saw this, that how will I open my bum for somebody to be checking? It is in alignment with El Shamin et al. 2024 on so many myths about cervical cancer causation, where eating of burnt food, stress and religious issue were tagged to be the cause of cervical cancer. We have wrong perception on cervical screening, as it was deduced as 57.1% of control group believe that going for screening will cause more harm than good. So they believe that they don't need to know, even if they have it. The gap that were identified was what took me to the development of guideline, and it was deduced that there was lack of awareness about HPV vaccination, lack of information about cervical cancer risk factor, misconception, and placement of premium value on their business above their health. And we have NGT, where we have stakeholders that were involved, nurses in oncology, data analysts, public health nurses, market women association leader, CHU, primary healthcare development agency, laboratory scientists, and oncologists. And the move of this was that from proposed guideline, I have the field work, the method, move to proposed guideline, and at the end, recommendation for this guideline. And what was the guideline that was proposed? The basement of it was health education, because once they are educated, we have captured them. And then to cervical screening, which should be made close to the market or in the market area. And then sexual sanity. Then the last one, which is HPV vaccination. And thank God when Ondo State government did last HPV vaccination, the highest people that, embraced it were market women. This really amazed me. And the recommendation, collaborative effort between nurses and other for time-to-time medical education and outreaches in the market and public places, availability and affordability and accessibility of HPV vaccination for all children to catch them young, and screening center in markets or close to markets or where women are densely populated. This study concluded that high impact of nurse-led education intervention was felt among the intervention group. There is moderate but high level of misconception about cervical cancer. We believe that it is a spiritual attack, and there is low uptake. The low uptake was really worrisome, despite the fact that it was in their domain. So we still need to talk to them very well. Finally, I will say, spread the message that cervical cancer is preventable if it is highly and curable, if it is detected early. And in this place, if it is detected early, it is curable. Women should be encouraged to go for screening anytime they need to go for it. I want to say thank you. These are my selected references, and these are pictures with the market women that shows when we are trying to make them. And these are women waiting to be screened at the market area. I want to say thank you so much for listening. That's the end of my presentation. Do we have any question? Any question? Any question? Any question? All right, if you don't have any question, I want to sincerely thank you for the audience. Let's bring on board the next. Who is present?
Thank you for that presentation. Another round of applause, please. So that's to tell you that you can see something repeating itself since yesterday. A speaker yesterday spoke about cervical cancer assessment, knowledge among Odoshida people. She also said they had poor knowledge. So you can imagine that all that we have been doing, that we think we are campaigning and that the people have knowledge, they actually don't have knowledge. Some are aware, but even the percentage of those aware are low, and the level of knowledge is really, really very poor. And you can agree that since they don't have adequate knowledge, the uptake will be low. That was what was reported yesterday, and that is also what Dr. Adigun reported today. So we have so much to do. Some of you might want to do interventional studies on cervical cancer, so please, you are free to do that. You can do health education among market women people. Hello, winner. Winner in the house, you are invited to see Dr. Adigun. Please give us few minutes. We are having issue with this other system.